So welcome, everybody. My name is Graeme Fraser. I'm a hematologist from the Juravinski Cancer Center, and will be chairing the meeting over the next day and a half. I'd like to welcome everybody. I've been a part of this meeting now for all 5 iterations of it. It truly is one of my favorite meetings that I attend. It is really unique. Your organizing committee always does an unbelievable job of putting together a top-notch list of nationally and internationally recognized speakers, but also in providing an opportunity for an exchange of ideas among all of you that are here. One of the unique aspects of this meeting is the ability for you all to have direct access to one another, sharing an exchange of ideas, but also the ability to interact with and ask questions of true leaders in the field from the medical standpoint, and we would encourage you to feel comfortable coming up and speaking with any of us if there are questions that come up over the course of the meeting. Take advantage of the opportunity. Those that have volunteered their time to come and speak to you really, again, spend a lot of their time thinking about CLL, interacting in their clinical practices for patients that have CLL, and are excited to be here, as well. Just a few housekeeping items, just before we head into the official schedule. The first thing, actually, in the spirit of reconciliation, the organizing committee felt strongly about acknowledging the fact that we are meeting on land that is traditional territory of the Anishinaabe, Ojibwe, Chippewa, and Haudenosaunee peoples. So we'd like to just make that acknowledgement as we kick off the meeting. There's a very diverse group of people in the audience. I know that many of you have come from a long way away. I understand that there are participants that have come from Europe, France, Lebanon, all through the US. I'm going to list off California, Connecticut, Maine, Michigan, New Jersey, New York, Ohio, Oregon, Pennsylvania, Tennessee, across Canada. If there's anybody from other places that I've missed, feel free to just yell it out now if you like. So this is an international meeting. This is not a Niagara or an Ontario meeting. This is really an international meeting with an international flavor, both from the attendees as well as from the speakers who are from various parts of North America, as we'll hear a bit later on. Meetings like this, particularly large meetings, and as you can, I think you have a sense, this is a very professionally put together meeting, requires support, and I would like to acknowledge the support of the sponsors for this meeting. They're up on the slide here. Specifically, I'd like to thank Janssen, our platinum sponsor, Roche and AbbVie, our gold sponsors, Lundbeck, Gilead, and AstraZeneca, silver sponsors. And I'll acknowledge that support again throughout the meeting. It is important, and generous donations have been made in order to bring everyone together and hopefully have a very successful meeting. So if there are any specific food issues, Rebecca, if you could put up your hand, you can come and talk to Rebecca. If there are specific allergies or specific intolerances or questions you have about the food, talk to Rebecca. Just a little bit about the format for the day. So we have tried to structure the order of the speakers so that we ease our way into it with talks that are geared to be more introductory and cover off some of the basic principles of CLL, and work our way up over the course of the day to some talks that could be quite complex. And CLL is an incredibly exciting disease in terms of the research and discovery that has gone on in the last several years. It's a very interesting time now. It is a very heterogeneous disease, and I think the audience members in meetings like this often are quite heterogeneous in terms of knowledge base and understanding. Some who literally have PhD level knowledge about CLL, and others who perhaps have been diagnosed very recently and the words are very unfamiliar. And we recognize that for both patients and their loved ones who are with them. Really we'll try and make sure we provide an event that covers off those bases and allows discussion on both ends. Just be aware that there's always going to be time for questions. A lot of the content within speakers' talks may well overlap, and that's purposeful in a way that that there will be recurrent themes that come up, and if you don't get a chance to ask your question with one of the talks, there'll be lots of opportunities later on to do so. We want this to be interactive. We encourage people to ask as many questions as they want. There are no bad questions. There are no dumb questions. So make sure you feel comfortable both in the question periods after talking, in the break periods, coming up and asking questions. And there will be a speakers panel that'll take place tomorrow, which is another opportunity to interact with the experts that will be presenting to you today. And as it relates to that, the speakers panel the format for that is there will be cards, Peter, correct me if I'm wrong here, cards that you can write your questions on, that you can bring forward, and that is how the questions will be asked during the speakers panel. We'll remind people over the course of the day. So as opposed to raising your hand and interacting that way, you're writing your questions down, and I'll get through all the questions during the speakers panel. So again, another excellent opportunity to be able to pick the brains of, again, real true experts in the field of CLL. I think that's probably sufficient for the introductory part of the meeting. Yeah, well, we just have, we'd like to just have a few people say some words who really provided the main support and organization of the meeting. And I'll just start with the first one is welcome messages from Dr. Ralph Meyer, who's the president of the Juravinski Cancer Center. Unfortunately, Dr. Meyer was not able to be here today. But I would like to give you just a short background about Ralph. He's a hematologist, has been a practicing hematologist for a long time. I won't use a number, he would get mad at me for that. So he really has, so hematological cancers and CLL are very near and dear to his heart. He's been practicing this field for a long, long time. He went off to Kingston and led the Cancer Clinical Trials Group for many years before coming back to take his current position at the Juravinski Cancer Center. He's been incredibly supportive of the hematology program at the Juravinski Cancer Center. Would have loved to have been here. He truly does enjoy interacting with patients and families. He sends his best wishes. Again, wanted to acknowledge the unique opportunity to come together yourselves, share ideas, and to interact with the international faculty that are here today.